So I would say the top line that I found is that what's happening on a collective level at the time when your identity is really solidifying or crystallizing is what creates the flavor. And so to give a specific example, when I interviewed folks who were in their, so again, I was doing these interviews in the 2010s. If they interviewed folks in their 70s and 80s, they were talking about if you're going to understand being gay, you need to understand the I'll call it criminalizing, but that's like a loaded term. So it could be the medicalizing where this is a diagnosis and you're going to get put away. It could be this will be in the newspaper and you will be outed. This will you could lose your job, whatever. So the act of disclosure being incredibly vulnerable, that's medicalized and criminalized, that was something that they talked a lot about. And if you're ever curious to find these kind of generational divides in your own space, listen for when people say, okay, if you're going to understand this, you first need to understand that. And whenever there's an order of events you need to understand. So if I was talking, imagine me 31 or probably like 29, interviewing someone in their late 70s. I'm like, oh, what does it mean to be gay? And I would always ask this really, like, I say as if you don't know this, but like I would always ask this like question that was super provocative. And I was like, there's no one answer. I'm gonna be real, like, I'm gonna be like a whatever about it. Um, Folks would always say, okay, whoa. We can't go there. First, you need to understand this. So
Mm.
for this older generation, it was disclosure as something that's criminalizing and medicalizing. And so being gay is a diagnosis. Being gay is something that I could lose my job for. I could go to jail for these things. Um, and then those folks would describe the HIV epidemic as a disruption to an identity that already existed. And so